What is COVID-19? COVID-19 is a disease caused by a new type of coronary virus that has spread around the world. It was first reported in China in December 2019. The coronavirus is a family of viruses that can cause the common cold. There are also serious respiratory diseases such as acute respiratory syndrome SARS and Middle East respiratory syndrome MERS. What are the COVID-19 variants? Over time, viruses such as the one that causes COVID-19 can change, which can result in new variants of the virus. These variants might have slightly different traits than the original virus. For example, some of them seem to spread more easily and quickly. Several variants of the virus that causes COVID-19 have appeared around the world in recent months, and some of these have now been found in the United States. Much is still unknown about these variants, including how well they can be detected with current COVID-19 tests, how effective the current COVID vaccines will be against them, and how well current COVID treatments will work against them. How does the virus spread? According to the CDC, the most common way for the virus to spread is during close contact with another person. When somebody who is infected coughs, sneezes, talks, raises their voice, or even breathes, they can create respiratory droplets that contain the virus. These droplets might reach the mouths or noses of people who are in close contact, within about 6 feet, which could lead to an infection. But there are other ways the virus might spread as well. Some small droplets and particles can linger in the air for minutes to hours. They might travel farther than 6 feet or might remain in the air even after the infected person has left, and they might be able to cause new infections, especially in enclosed spaces that aren't well ventilated. This form of spread, known as airborne transmission, isn't thought to be as common as spread through close contact. Respiratory droplets can also land on surfaces, which people might then touch. This could potentially lead to an infection if a person then touches their mouth, nose, or eyes. However, this is not thought to be a common way for the virus to spread, according to the CDC. Some people who are infected but do not have symptoms, that is, are asymptomatic, may still be able to spread the virus. Because of this, it's important that everyone follow the CDC's and other health departments' recommendations on how to protect yourself and others. How can I protect myself and others from getting COVID-19? According to the CDC, there are things you can do to help lower the risk of being infected, as well as infecting others. It's important to note that the CDC now has different guidance for most people who are fully vaccinated. Wear a mask that covers your mouth and nose when around others. Avoid close contact being within 6 feet of people who don't live in your household and any people who are sick. Get a COVID-19 vaccine as soon as it is available to you. Avoid crowded indoor spaces such as restaurants, bars, and gyms. Avoid indoor places with poor air circulation that do not allow as much fresh outdoor air as possible. Cover your cough or sneeze with a tissue, then throw the tissue in the trash, or cough or sneeze into your elbow. Then wash your hands right away. Wash your hands often with soap and water for at least 20 seconds, because it's one of the best ways to kill germs on your hands and prevent the spread of germs to others. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands, because if you picked up the virus, you could infect yourself by allowing the virus to enter your body. Stay home, except to get medical care, if you are sick. Clean and disinfect frequently touched surfaces daily using a regular household cleaning spray or wipe. Always read the directions of the products closely to make sure you are using them correctly. Cleaning and disinfecting products should not be used directly on skin, taken by mouth, or inhaled into the lungs. Disinfecting products, like bleach, should not be used on food. If you are a cancer patient, survivor, or caregiver, talk to your cancer care team about whether there are any additional precautions you should take. It's important to keep in mind that some people who are infected with the virus might not have symptoms, but they could still spread the virus to others. Because of this, it's important that everyone follow the CDC's recommendations on how to protect yourself and others. Should I wear a mask? The CDC recommends that people who have not been fully vaccinated should wear a mask that completely covers the nose and mouth while out in public, especially in places where you might be close to other people. Masks might also be recommended, or required, even for people who have been fully vaccinated in some settings. This might be especially important for people with weakened immune systems. Cloth masks and gaiters, cloth coverings that wrap around the nose, mouth, and neck, should have at least 2 layers of fabric and should fit snugly against your face. The CDC does not recommend wearing a mask that has a one-way valve or vent because when you breathe out, it allows droplets to go through the mask and possibly spread the virus. The CDC also does not recommend the use of a face shield alone, without a mask. The mask is meant to help protect other people because you could spread the virus if you are infected and don't have symptoms. At the same time, when someone else wears a mask, it can protect you, too. Together, this can help slow the spread of COVID-19. Many other authorities and businesses also recommend masks, and some might require them. It is best to check with your local authorities to see if your area has specific guidelines about wearing a mask in public. It's important to understand that wearing a mask is not a substitute for social distancing. It's still very important to stay at least 6 feet away from others who don't live in your household, even while wearing a mask, and to continue to wash your hands frequently. Remember to wash your hands before putting on your mask, to not touch your face while wearing the mask, and to wash your hands right after taking it off. The CDC does not recommend that people in the general public wear surgical or N95 masks. These are in short supply in many areas and should be saved for healthcare workers who need them when caring for people who are sick. What if I've already gotten a COVID-19 vaccine? For people who are fully vaccinated, the CDC has guidance on things you can now do, as well as what types of precautions you should still be taking. This guidance is being updated regularly, so check the CDC website for details. The CDC guidance may not apply if you have a weakened immune system, so it's important to talk with your healthcare provider about which precautions you still need to take. What are the symptoms of COVID-19? The most common symptoms of COVID-19, which may appear 2 to 14 days after being infected, are fever, cough, shortness of breath, chills, muscle aches and pains, sore throat, new loss of smell or taste, feeling very tired, headache, diarrhea, nausea or vomiting, runny nose. Contact your doctor or local health department if you have any of these symptoms. It's important to know that some people who are infected with the virus might not have symptoms, but they could still spread the virus to others. Because of this, it's important that everyone follow the CDC's recommendations on how to protect yourself and others. Which people are at higher risk for serious illness if they get COVID-19? According to the CDC, the risk for severe illness from COVID-19 increases with age, with older adults at highest risk. People with certain medical conditions are also at increased risk. This includes having cancer, having a weakened immune system, after getting an organ transplant, after a stem cell or bone marrow transplant, or after getting certain treatments like chemotherapy, being overweight or obese, smoking. Can I get COVID-19 from a blood transfusion? According to the American Red Cross, there is no evidence that the virus that causes COVID-19 can be transmitted through a blood transfusion. Donating blood is still possible for those who are healthy and feel well, and it's greatly needed, according to the Red Cross. The COVID-19 outbreak and resulting social distancing has led to canceled blood drives and dramatic blood shortages in many parts of the country. Can I get tested to see if I'm infected or was infected in the past? Tests for the virus that causes COVID-19 can be done on samples taken by swabbing inside the nose or throat, or on saliva samples. The testing field is changing rapidly, but not everyone needs to be tested for COVID-19. The CDC has issued guidance on who should consider being tested. This is based on things like if the person is having symptoms, if the person has had close contact with someone known to have COVID-19, if the person is likely to be exposed to the virus, as is the case for many healthcare workers, if the person is in the hospital or is at higher risk for complications if they're infected, if you are having symptoms that might be from COVID-19 or have been exposed to someone who has it, call your doctor or health department to discuss whether you need to be tested. Are at-home tests an option? For most of the COVID-19 tests in use, the samples need to be obtained by a healthcare professional. But for some tests the samples can be collected at home. Most at-home tests use swabs to collect samples from inside the nose. Some tests use samples of saliva. Many at-home tests still require a doctor's order before they can be done, but some newer tests can be done without the need for a doctor's order. What about antibody tests? These tests look at a person's blood for specific antibodies, immune system proteins, that would show that the person has been exposed and had an immune response to the virus. Antibody tests do not look for the virus itself, so they can't be used to tell if someone is currently infected. They can only tell if a person has been exposed to the virus at some point. It's not clear how useful the results of antibody testing are at this time. While many different antibody tests are now being used, the results from some of them might not be as accurate as others. And even with an accurate test result, experts aren't yet sure if having a positive test means that you can't be infected again. What about vaccines for COVID-19? The CDC recommends that anyone 12 years of age and older be offered the vaccines. Being vaccinated does not mean that we can throw caution to the wind and put ourselves and others at risk, particularly because research is still ongoing into how much vaccines protect, not only against disease, but also against infection and transmission. But it's not vaccines that will stop the pandemic, it's vaccination. We must ensure fair and equitable access to vaccines and ensure every country receives them and can roll them out to protect their people, starting with the most vulnerable.